Hey guys, I'm going to tell you a little bit about Delaware Present Therapy and being a concierge therapist and what a concierge therapy practice is. So, Delaware Present Therapy, we are a concierge therapy practice. We are actually growing and expanding, which is really cool. So, now we have a nurse practitioner who offers medication to our mental health individuals who are able to be maintained stable in an outpatient setting. So, you're looking for treatment for anxiety, depression, PTSD, those type of things, then we're getting you the help that you need. We also have amazing partnerships with individuals who do mood and thought disorders. We work specifically on creating a nurturing, compassionate environment for anyone who walks in the door. So, what does that look like for our clinicians? So, our clinicians are constantly growing and expanding, right? As the practice goes, we get more and more. But the primary heart of every clinician is that they love their client. They want what's best for their client. They're going to advocate and empower their client, and they're going to provide their client with those evidence-based therapy skills. What we do as a concierge practice that's a little bit different is we offer close to 24-hour support outside the hours that we're kind of sleeping, right? So you have us available through a HIPAA compliant app. When you're coming into our office, we keep snacks all stocked, your favorite snacks, your favorite beverages. We offer the option of emotional support animals during those therapy sessions, whether you want an emotional support kitten or puppy, up to you. We try to make it as homey as it can be. We try to make you feel connected. We want to be there for you. Concierge therapy comes with this customizable approach where you have your therapist as the expert, but you also have your therapist building this constant relationship with you so that you know that they really are prioritizing your growth. So, what that looks like is we don't take on as many clients, and the reason why is we need to be able to give you that time dedication so that you can grow in the manners that you want to grow. Everyone is trained in evidence-based approaches. Everyone is trained in the most effective approaches for things like borderline personality, self-harm, using those DBT skills and those DBT trainings. We're looking at cognitive processing therapy, cognitive behavioral therapy, EMDR, brain spotting, those ones that are really good for trauma. And then we have, like CBT, which is really good for kind of thought, depression, anxiety. What we do is we really just try to help a person get unstuck. We do this in all very customizable ways, so we're meeting you where you're at, and you always feel heard. I can't tell you how many times individuals come in and either they feel like they're being heard too much, where there's no expert input being put in, or they feel like they're not being heard at all. So our goal is to always make you feel heard, to make you feel loved, to make you feel seen, and so that you know that you're an integral part of the practice. This is your treatment. You're the expert on yourself, but we're the expert on the skills. What we're going to do is we're going to help you apply those skills to your life and then figure out which one works best for you in which situation. We want you to feel comfortable when you're coming in. We want you to feel comfortable when you're leaving. We want to meet you where you're at. So, if concierge therapy, phone coaching, having access to your therapist is important to you, walking in the door, having your favorite food or beverage ready, this also actually really gives us a good opportunity when it comes to eating disorders and individuals with disordered eating that we work with. Them snacking and learning mindful eating and learning those different food techniques while in a therapy session are very beneficial to them to continue it outside of the therapy session. We're huge proponents for doing things in therapy, so you're more likely to practice them outside of therapy. So your therapy is also going to be very interactive. We might do a little talk therapy at the beginning, but what it's really going to be is you're going to learn the skills in order to change your own biochemistry. And that's really the goal. We want to expand that neuroplasticity. We want to make sure that you're learning as much as you can so that you can deal with the stressors of life. We want to give you the tools so that eventually when you leave us, you never need us again. You have it all with you. So if this is the type of treatment that you're looking for, a little bit more personable and personalizable approach, then give us a call and we're the place for you. I hope everyone's having a great day.